Hello, everyone. My name is Lorraine, and today we'll be discussing discharge planning for a patient recovering from postpartum hemorrhage. This is so crucial to ensure that ongoing recovery happens, also preventing complications, providing appropriate follow-up care. And here's some comprehensive discharge plans that we could do for our patient with postpartum hemorrhage. As far as medical management and follow-up goes, the prescriber might prescribe medications such as iron supplements to manage anemia, provide urotonic medications if needed, pain management medications as required, antibiotics if there was an infection or risk for infection. There will also be follow-up appointments. Would teach the patient to schedule follow-up appointments within 1 to 2 weeks for physical assessment and hemoglobin check. Additional follow-ups may be necessary for anemia monitoring or if surgical interventions were performed. Also, probably some lab tests for hemoglobin, hematocrit levels, monitor coagulation profile if needed. Also educate the patient on self-monitoring, and you can instruct the patient on recognizing warning signs that require urgent medical attention, such as heavy bleeding or vaginal bleeding. How many pads are they soaking through per hour? Are they passing large clots? Are they experiencing any dizziness, fainting, or rapid heartbeat? Are they experiencing severe abdominal or pelvic pain? Also teaching on signs and symptoms of infection such as fever, chills, foul smelling discharge. Teaching them to do activities as tolerated or lifestyle guidance. Encourage rest while gradually increasing activity levels. Avoid strenuous activities and heavy lifting until cleared by a medical provider. Also, hydration and nutrient-rich diet is needed to support recovery. On the emotional support and mental health end, we can discuss potential emotional impacts like anxiety or postpartum depression, offer counseling referrals, or connect the patient to postpartum support groups if needed. We could also provide breastfeeding support, provide lactation support to address any concerns or challenges related to milk supply or feeding techniques, on the birth control and contraceptive and family planning. We could discuss safe contraception options tailored to the patient's health and recovery timeline, provide emergency contact information. We're going to provide clear instructions on when to seek emergency care, ensure the patient knows how to reach their health care provider. As far as social and home support go, we can assess their home, their support systems, ensure that the patient has adequate help during their recovery. Consider referrals to community resources or home health services if needed. Pretty much these would be the interventions for discharge planning from a patient recovering from postpartum hemorrhage.